Okay.
All right. Welcome to Willow Legal Group's Coffee Chat. We're here today with Christy. And Lindsay, you want to do an introduction? Of course. So welcome, Christy.
Thank you.
So Christy is a licensed acupuncturist, and after 20 years working in the fitness industry, she decided to pivot and go back to school and earn her Master of Acupuncture from the Maryland University of Integrative Health. She recently opened an office in downtown Frederick, and she now specializes in treating orthopedic injuries, pain management, perimenopause and menopause symptoms, and anxiety. Christy has a strong desire to help individuals find balance in their life through movement, nutrition, and Chinese medicine principles. So we are so excited to have you on today.
Thank you.
So I want to talk about all things acupuncture because I know a lot of people. I love acupuncture. I know a lot of people are scared of it, but tell me a little bit about what is acupuncture and what it's good for.
That's a super big question.
I know. We'll start high and then we'll narrow it down.
I think, to address the part of people are really scared of it, I think it's just because they don't know what it entails or what it's all about. And most people are scared of needles just because they're used to vaccines or shots or, IVs. And it's very different than that. The needles are about the size of a hair. So it's very different than putting a shot in your arm. Mm-hmm. But I think as far as what is acupuncture, that's too big of a question probably for us to even address. But I think that it just depends on the acupuncturist, which practitioner you find, what type of acupuncture they've studied and what type of principles. And then that determines how they practice. So there are some practitioners that definitely take more of a spiritual, emotional approach to it. Others take more of a physiological approach to it. And I think I fall somewhere in the middle there, where I look at the body because I have a strong background in kinesiology and exercise science. I look at the body from a physiological standpoint and then figure out how can I get the person to feel better, both physically and mentally. And the way I look at acupuncture is it's kind of like a little nudge, when you put the needle in somebody, it's just a little nudge of hey, remember, this is kind of how you should feel, or this is having this pain here is not normal. So I'm just going to give your body a reminder, but really, I don't think it has a lot to do with the practitioner. I think it has to do with the patient. And your body is meant to be healthy and your body wants to be healthy. And so I think acupuncture is just one of those ways of a little reminder to your body of hey, we can feel better. Or, hey, we need to focus here and then we'll feel better. But as far as what does acupuncture treat, there's not much acupuncture doesn't treat. I think a lot of people seek it out for pain because that's easy because they see, okay, I had pain, I had acupuncture, I now don't have pain, right? And so they're oh, acupuncture works. I think with some of the other things like hormone balance or even some digestive stuff and even anxiety and depression, it's a little more subtle and it might take more time before somebody realizes oh, I think this is having an impact on my life. But there are definitely I think pain, I think fertility is a big one where there's a clear, this worked. I couldn't get pregnant. I had acupuncture. Now I'm pregnant, right? It's very cut and dry. Okay, this works.
Yeah. Yeah. I think those are the most common things that I've heard too. And I've used acupuncture for many of those things myself. But just, stress management and the things that, like you said, people don't realize. I don't see Christy right now. I have someone else I've been seeing longer than Christy has been graduated, and I'm very loyal. But even just congestion, needles in your face, that helps get that drainage out, and allergies and digestion and all the things that you can think of, acupuncture can probably help. And I'm forever going in saying things okay, this hurts. Can you fix me? Mm-hmm. And it's always, let me try something.
Yeah.
Usually there's at least some kind of subtle change.
And the funny thing is, I think with all the respiratory viruses that have been going around this season, like everybody has been sick, right? And it's been lasting for like weeks and weeks and weeks. And I've had so many people come in and they're like, look, I've been coughing for 6 weeks. I'm going insane. Make it go away. And you do a treatment and then they don't cough anymore.
Oh.
And they're kind of like blown away, right? They're like, I don't understand what you did. And if I start talking about, well, I anchored your kidney, I descended your lung chi and anchored it with your kidneys. They're like, what are you talking about? I don't care. I'm not coughing.
Right.
Yeah.
Agreed. So I wanted to ask you a little bit about your pivot. And when I first met you years ago, you were a trainer and you've been a trainer for a long time. And then I was very excited to hear you decided you wanted to go into something new. But did you have anything specific that kind of led you down that path?
I think it was kind of multifaceted. So the pandemic hit. And when the pandemic hit, my husband and I closed our actual like fitness studio. And I realized that the online space was just not for me. I like connecting with people and I couldn't connect over a screen the same way I could in person. And so I knew that wasn't going to work for me being an online trainer. But then I was also, even before the pandemic hit, kind of having that like midlife crisis of I'm in my 40s and I don't know that I want to be a trainer forever. Who's going to want to hire me when I'm in my 50s, right? Like nobody's going to want to hire like a 50-year-old trainer was what was in my head. But I knew I wanted to stay in the health and wellness space. And I had experience with acupuncture in the past, and it always worked wonders for me, where I never understood it, but I was always like, you know what? Every time I went, it worked. I am kind of curious about this. And so I decided to apply to school. I think I didn't tell Eric that I applied until after I had actually applied. And then, I enrolled in a 3-year master's program, and most of the people in my cohort were in their 20s. And then there was me. Yeah. But it was really interesting. It was great to challenge myself in a different way, go back to school. That just worked my brain in a totally different way, where I think I had become pretty complacent after working in fitness for over 20 years. And so this got me thinking in a totally different way. I had to learn, technology in a different way with like all the educational platforms. I had to write papers again, just all that stuff that you kind of forget about. And then on top of it, you're a mom and a wife.
Yeah.
Right. So it's just very different. Yeah.
No, that's awesome. And so I guess, what do you love about it? Like, we've talked a little bit before we started recording, but like, what do you love about acupuncture? And, why do you think everybody should do it? Maybe I said that, not you. I think everybody should do it, but
I think everybody should do it too. I think why I love it is because I'm humbled by it. And if you ask any of my patients, they'll tell you that my face, like anytime they tell me they feel better, I'm like, are you kidding me? Like, this is insane. This works. You know what I mean? Where like somebody has shoulder pain and I put a needle in their shin and their shoulder pain goes away. Like, it's fascinating to me. And I think that the fact that I'm going to be studying the medicine for the rest of my life, like there's so much more to learn and there's so much more to understand. I think that's really exciting for me. Where fitness had gotten, it wasn't as exciting. And this, I feel like I could use the rest of my lifetime and I'm still not going to know enough.
Yeah. I know I personally find it fascinating. I've considered learning more about it and I'm like, stay in your lane. Yeah. No shiny, like, but it truly is fascinating. Because it does help with things that you would never dream of. And like, yes, my shoulder hurts and you're putting something in my foot. Like what? Yeah. And whenever I go in and it's like my something hurts and she squeezes my hand and she's like, does that hurt? I'm like, why? I don't understand what you're doing to me. But then she fixes it and it's magical.
It's magical. It really is. And I think to answer your question about why should everybody do it, I think that people shouldn't look at it necessarily as like I'm hurt or I'm sick, I'm going to go to acupuncture. It could be a preventative thing too. And I think that if we start to take control of our health, we'd be in a much better state. Like society would be in a much better state if we were a little more proactive about our health instead of just being reactive all the time.
Excellent point. How often should people go?
That's a really hard question because it's definitely like it's individual dependent, right? It's also, is it an acute issue that needs like addressing where it might be they need to come a couple times a week for a couple weeks and then it's resolved? Or is it chronic? You know, if you've been having pain in your low back for 15 years, don't expect that after one treatment, it's just going to be gone. So I always tell people, I would like you to be consistent until we see that there's a change, and then we can start spacing it out. And I think ideally, if somebody was healthy, they would come to acupuncture like 4 times a year, like, and get like a seasonal like adjustment, like just kind of like a tune-up, and then only see their acupuncturist if there was something acute. But to get to that point takes time.
Do some work. You got to figure it out.
You got to figure it out. And it's also your practitioner learning you too, because you come in and you talk about things that are wrong or, you know, issues that you're having. And we have to kind of diagnose and figure out from a Chinese medicine standpoint, what's going on and then what's going to make that better for you.
So yeah, you just made me think of something too. So acupuncture obviously is a Chinese medicine. I don't know what word I want to use. Treatment. Yeah. How does that differ? How can it be used along with what we have, the traditional Western medicine that we're so used to here?
Oh, I think it can be used like as an adjunct complementary therapy for a lot of things. I mean, if you look at for anybody going through chemotherapy, acupuncture can be great at offsetting different symptoms that they have from chemotherapy. But it also, you know, if we're looking at like middle-aged women going through perimenopause and menopause, even if you're doing like hormone replacement therapy from a Western medicine perspective, you can supplement and help with the anxiety and the brain fog and digestive issues and all kinds of other like hot flashes, you know, things that happen that Western medicine can't address, Chinese medicine absolutely can address. So I think they can work really well together. I guess I would encourage people to not always just accept like a Western medicine diagnosis, because there could be an answer on the Eastern medicine side.
Yeah, no, I agree. And I guess, what do you say to people who say that it's too woo-woo?
I've had people tell them that. Yeah, I've had that. And I just say that it's on the practitioner, right?
Okay.
So if I have somebody who really wants to get like kind of woo-woo and like a little more spiritual, like I can go there, but that's not my general like vibe with people. I'm much more like physiological, and this is what's happening inside of your body, and this is why we're addressing it this way. So I think it's just finding the right practitioner. Yeah, for you. And it's no different than finding the right doctor, right? The one that you feel comfortable with, the one that you can open up to, the one that you feel like listens to you and hears you and has your best interest at heart.
For sure.
Yeah.
So there's a couple questions we always ask people that I kind of already asked you, but one was, what inspired you to focus on acupuncture? And I think you kind of answered it, but if there's anything else you want to throw in there.
Yeah, I think it was just personal experience with it, and always being kind of fascinated by, this doesn't make sense that this works. And I want to study it to kind of understand it a little bit more.
And now you do.
And now I do. Yeah. Yes, I hope so too.
So what's one piece of advice that you wish more people understood when it comes to acupuncture?
Just to be a little more open-minded to it. And don't think that, I guess I just don't think that you are your diagnosis. I think that that's so, like, that happens so much in this country where it's like, I have this, I have that. And it's like it's a sentence. It's not like a question. And I think that anybody could try acupuncture, whether it works for you or not. I can't promise. But I think that it might help even with issues you don't realize you're having. You know, like I've had patients before come in for clogged ears or, you know, something like that. But then all of a sudden they realize, oh my gosh, I'm sleeping through the night. I didn't even realize I wasn't sleeping through the night. Or I don't wake up with back pain anymore. That's weird. You know, so I think we get so used to like living a certain way or accepting just saying, oh, I'm getting older. So of course my knees hurt. I'm older, but it just doesn't have to be that way. Yeah, we can take more control.
What do you say to people who are scared of needles and won't try it because of that?
I usually show them the needles, and I actually like I let them like touch them and like feel them. I also there's other things that you can do in an acupuncture session, like cupping and gua sha and acupressure. So there are other things like other modalities we can use to still help.
Okay.
But I've convinced, like I've even had teenagers come in that are like, absolutely not, you are not putting a needle in me. And next thing you know, they've got, you know, 15 needles in their knee.
And
so
they don't
like,
even notice.
They don't even notice. Yeah. So a lot of it's just education. It's a lot of like building rapport with your practitioner. And then talking to your practitioner, like, hey, that didn't feel good. I didn't like that. But I usually always show them the needles, and actually like have them touch them to show that they're flexible, that they're thin, that it's very different than a shot.
Very different.
Yeah.
And yes, gua sha is awesome. Love
gua sha is amazing. And so is moxibustion.
I don't know that one yet.
Oh, you haven't done moxa?
No.
Oh.
Add that to my list of things.
It's lovely. It's lovely.
And then our last question that we ask everyone is, what's one item you can't live without in your day-to-day life?
I hate saying this, but I think it's coffee.
You don't have to hate saying that.
I mean, I think if I had to give it up, I could, but my morning would not be as enjoyable.
Yeah. Or my afternoon.
Yeah, I know. I feel like that's a super lame, like I should have a better item.
No.
Yeah, but I think that's it.
If that's your truth, that's my truth too. It's all right.
It is what it is.
Awesome. Well, thank you so much.
Thank you. Thank you guys for your time.
Yeah, we'll make sure we put Christy's information in the chat or wherever it goes. Megan's
we'll get your information out there when this posts. And thank you so much for joining us. This was great.
Of course. Thank you guys.